We are Rural Health Service Corps, and we are always looking for good people to serve the community and people in need throughout South Central New York. What follows are some interviews with some of our members where you can learn more about what it is to be a Rural Health Service Corps member.
I'm Pamela Guth, the Director of Community Health Services at the Rural Health Network of South Central New York. We have a geographic footprint of 3 counties, primarily Broome, Tioga, and Delaware. We assist individuals and their family members in accessing healthcare supports and services, and we also participate in local planning and capacity building to be rural advocates in that arena.
My name is Rebecca Chandler. My title is Healthcare Access Associate. I served as project manager of a service needs assessment of rural Broome County called Rural Broome Counts. I was always interested in community service. I did a lot of community service in high school and college. And I'm applying to medical school right now, but I had like a 2-year gap between when I graduated college and when I would start medical school. And I liked that this had a public health focus. I felt like I would gain a lot of experience and knowledge through this position. People continuously tell me how important this work is and how much it's going to help people. It really made me feel good, and it was nice to know that this work really does matter. You know, I could have learned a lot of the things that I learned about public health in classes, but there's something to be said about being immersed in the experience. I feel like I learn a lot more because I'm thinking about it every single day. You grow professionally, like I said before, and you just learn a lot about yourself and about if you wanted to do healthcare or medicine, especially, this is really relevant.
My name is Sohaib Fassi Ahmed. I'm a Healthcare Access Associate here at the Rural Health Network. I take intakes for people that are looking for a variety of healthcare needs, whether they are looking for health insurance, food, dental, vision, or prescription help. I'll either try and help them directly or link them to someone who will be able to help them. It is a structured service position, so you do get to help the community, but you have a very specific role, and your presence here is actually important. It's a very strong community environment here, and people talk to each other, and I can see the impact we have by every next person that comes in that will say, okay, you helped this person so much and I'm in a similar situation, so can you help me? And I think even for the people that maybe don't need immediate help, it provides a security blanket to know that there are people here that are willing to help them if they're ever in a time of need.
My name is Kristen Lamb. I am a health access specialist at Mothers and Babies Perinatal Network. What I basically do is a lot of going into the community and finding people who don't have health insurance or are underinsured or are not happy with their health insurance and try to get them connected to our navigator services here, which help people sign up for health insurance on the New York State of Health Marketplace. Evan and Brianna, they're great people to work with. We all kind of share the load of the work. I got to know them really well.
The navigators and the other members of this organization don't really have the funding to go out and do what we do. They like to call us the boots on the ground. So there'll be many times where we actually find people, and then there's a direct connection between us finding someone and then them getting health insurance that wouldn't have been possible without us being out there in the communities looking for these people.
I've probably influenced and helped about over 100 people so far over my term connect and have interviews at least and get help with anything. Everything that I've learned in social work classes in school, I have applied here. I think that was the biggest reward, like using my skills that I learned.
I think you're given more responsibility and more accountability in a more AmeriCorps position versus an internship. Like, people take you more seriously than they would an intern who's just gonna leave in a couple months. Like, this is a full year kind of thing. You get to see people regularly out in the field and know that you're actually helping them. I think the work is a little more focused.
If you are a genuine good person and you want to help people in the world, AmeriCorps is such a good opportunity just to get that out there in the community. You can really show your passion about the agency and a passion about helping other people.
It's kind of like the perfect post-college graduation job.
I would say do AmeriCorps because you will make an impact on the community and you will make a ton of connections and meet really awesome people and you'll have a great time.
You have heard about some of the professional and personal development opportunities through Rural Health Service Corps. There are also some financial benefits to being an AmeriCorps member. Full-time members receive a living allowance broken down into biweekly payments that are deposited directly into their bank account. After a member's service term is complete, they are also given a Siegel Education Award. This amount can be used to pay off any federal student loans a member has accrued, or it can be put towards future education expenses, such as graduate school. And while a member is serving, Rural Health Service Corps can provide them with health, vision, and dental insurance at no cost. Now that you've seen how service can impact the lives of others and communities, we hope that you'll consider a position with the Rural Health Service Corps.